Hi, everybody. Welcome to the European Youth Parliament's Health Summit, which is a series of events that we have planned around our policy recommendations paper on health to showcase what young European takes on healthy lives and well-being for all are. I am Isa. I am a project manager at the International Office of the EYP. And as many of you know, EYP's mission is to empower young Europeans to become open-minded, tolerant, and active citizens. And we do this by organizing and creating a platform for young people to express their opinions and share their views with one another and also with experts and policymakers in the field. This health project of the EYP has been going on this year with the support of the Wellcome Trust and EIT Health. And today we will be having an event to talk about the health governance in the paper and our recommendations for this pillar. So without further ado, I would like to introduce our moderator for today's event, Peter McManus. Peter is long-term EYPer. He's a final year medical student in Belfast, has a master's in global health, and also joined the health project of the EYP this year as the president of the Digital Health Forum and also as a participant of the think tank. So he's been quite instrumental in this journey. Peter, thank you so much for joining us today, and I'll pass the word to you.
Perfect. Yeah, thank you so much, Isa, and it's really good to be here moderating the kind of output of the health project, having been involved all the way through. So basically what we're hoping to do today is present young people's views on global health governance and our policy recommendations for reform as we move out of the post-COVID kind of world. So I suppose what we're going to do is we've got a couple of guest speakers. So I'm going to introduce each of them one by one to get some introductory remarks. And then I'm going to hand over to Chris from the think tank to present the governance recommendations from the EYP health policy paper. So our first guest today is Dr. Beth Thompson, who is head of UK and EU policy at the Wellcome Trust, which is the foundation that exists to improve health by helping great ideas to thrive. And it's been really great to have the support of the Wellcome Trust at EYP's health events over the last few months. So Beth has led Wellcome's UK and EU policy activities since 2017, covering areas such as Brexit, research investment, and emerging technology. And she also leads Wellcome's new programme on research culture. She's also been awarded an MBE for services to science for successfully advocating against amendments to GDPR that would have been severely damaging to research. So it's great to have someone so qualified with us today to discuss these issues. So I'm going to invite Beth if you would like to make some introductory remarks.
Thank you, Peter, and hello everyone. It's great to be here and to have the opportunity to talk to you today, but mostly to hear what you have to say in your recommendations and to then be able to discuss that. As Peter said, my role at Wellcome is really about shaping the UK and EU research environment. So most of my day job is about Brexit, is about research investment and making sure we have the right regulatory systems around us so that innovation and research can thrive. But recently I've been working much more closely with our global team who work on a number of issues in global health and who, as you can imagine at the moment, are extremely busy on the COVID response. Within that, one of the things that I'm doing is leading some of our work, thinking about what does long-term reform look like after COVID? How should the world adapt and change so that we're better prepared to prevent epidemics in the future and to respond when they do happen? Because in our view, it will happen more frequently and epidemics are likely to become more complex as the world around us is changing with things like increased travel and global heating. I'm not going to talk too much more about my role, but I thought what I would do is share some different ways in which Wellcome works, because we're an unusual organisation. We are the biggest foundation in Europe in terms of the amount that we spend, and that is there to improve health in a number of different ways, but predominantly through research, by funding research and improving the way that research is done, and then advocating on that to make sure that it really makes a difference to the world. So there are three areas that I thought I would talk to you about briefly. The first is looking at some of the work that Wellcome has done to mobilize the resources that we need to create the R&D that will really drive the global response. So looking back to after the Ebola epidemic, we worked with a number of other organizations to create the Coalition for Epidemic Preparedness Innovation, CEPI. And this is a great example of how Wellcome has convened organizations to take a strategic approach to a problem and also mobilize the resource needed to actually do that. So CEPI has been creating vaccines for infectious diseases so the world is better prepared and has an insurance policy to respond in future. That really has transitioned into a whole suite of work, working with the European Commission and other partners to make sure that we mobilize the resources needed to tackle COVID. And that's a huge part of the team's work at the moment, particularly mobilizing work for the ACT Accelerator. Another aspect of Wellcome's work is looking at the interface between science and society. We have a public engagement team who look at what society thinks about issues in research and health, and how we can better equip people to engage in discussions about their health. And here we can perhaps talk a bit later about the Wellcome Global Monitor, which has looked at attitudes across the world to different issues. And we've got some fascinating data, for example, on vaccine hesitancy. So do people think that vaccines are safe? And we see wildly different numbers across the world. But even within Europe, we see something like 50% of people in Eastern Europe agreeing that vaccines are safe, compared to 76% and a similar number. So that's in Southern Europe, a similar number in Northern Europe, and about 59% in Western Europe. And I think it's so interesting to understand these differences in our societies and unpick them. And that's one of the things our public engagement team tries to do. And I'm sure later we're going to talk about trust and communication, where this is so important. Finally, I wanted to talk about open access, which I've also seen as one of the recommendations in your paper. This has been a hugely important issue that Wellcome has advocated on for a long time. And I'm preaching to the converted here. I think COVID shows more than ever why it's so important to be open and transparent about our research findings. So I will stop there, but I'm really looking forward to our discussion today and any questions that you have later.
Right. Thank you so much to Beth for those very insightful opening remarks. So our second guest today is Professor Stefan Elba from the University of Sussex. So Stefan is a Professor of International Relations and the Director of the Centre of Global Policy. So his expertise lies in the links between health and security, as well as the international politics of disease. And he has also written about some of these topics, both in his research and in multiple published books. So with that being said, I'd like to invite Stefan, if you've got some introductory remarks.
I do. Thank you very much, Peter, for the kind introduction. Thank you, Isa, for the invitation to be part of the summit. Thank you, Beth, for your comments. And thank you, those in the audience who participated to the report. I don't want to preempt the conclusion, but the report is excellent. It's well informed, it's up to date, it's succinct, and it does all the things I think that a great report needs to do. And it's easily on par with what comes out of, leading global health think tanks. So it was wonderful to read. What I would like to offer is maybe a slightly different perspective, more from the academic field, because at the University of Sussex, we have a kind of research center which looks at the international politics and the global governance of health and looks at how these things come together. And so for me, what was really striking, I think, was, there was something that's in the report implicitly, but it's not explicitly teased out. And so I think this is just what I want to focus my introductory comments on. And it could be summed up actually in a single word that I'm asking you to take seriously for the next 5 minutes. And this word is structure. Okay? And what I mean by this is that, you know, the pillar in the report that we're going to talk about today is the governance pillar, right? And governance is already quite a strange term. You know, it was invented to try to capture a domain of activity where people are working together loosely towards a common goal, but without any kind of central government or central authority. And so that's why it's called governance and not government. And of course, when we're dealing with global health and with international health, we are dealing precisely with this kind of situation where we don't have a central player who can keep everybody in line and make things happen. And so global health governance really is, at the end of the day, a coalition of the willing. You're trying to constantly bring together like-minded people who care about the health of people who live beyond their borders, but you're constantly having to cobble together alliances. You're trying to find, you know, high-income countries that can give aid and finance global health initiatives. You're trying to bring on board civil society. You're trying to bring in philanthropists, charities, you know, people like the Wellcome Trust. You're trying to bring in science. You're trying to get people to loosely coordinate around the goal of reducing health inequalities in the world. But because there is no kind of central authority in all of this, you also get problems and challenges. And what I want to say to you is that most of the challenges that you have picked up in the report and the things that you want to see changed are actually kind of linked to this structure. So what you don't get without a kind of central leadership role is you get a less unified approach. You get certain things getting missed. You get some bits pulling in different directions, which is why you guys are calling in the report for a more unified approach. You also don't really have anybody at international level who can enforce the rules. If a country decides not to follow the international health regulations, there's not that much that other people can do about it, which is why, of course, the report also calls for a stronger role for WHO and more authority for WHO. There ultimately, in this kind of system, also limits to what you can actually do in terms of eradicating inequalities, because at the end of the day, it basically still remains a self-help system for most countries. There will be rich countries who will have stronger health systems. There will be low-income countries. Some of them will receive aid, others less so, which is why you have persistent inequalities, and which is why the report rightly calls for universal health coverage and more resilience in health systems. And of course, you also have, in this kind of political system, without a central authority, health competing with all the other priorities that are out there, and which is why you want to change this and have more of a health in all policies approach. So I think my reaction to reading the report, which is an excellent report, is that we also have to find a way of thinking and beginning to talk about the structure of the system itself. And this is really important for your generation, because my generation, as we get older, you know, we get socialized and habituated into the existing structures, and we don't have the same kind of room to experiment or to demand bigger things than you do. But especially as the European Youth Parliament, you know, when you think about the European project, right, it came about at a moment when, after 2 world wars, people started to say, actually, you know, nation states, we have to have something more than that to have peace and prosperity. And I think for your generation today, it's not the same problems. Luckily, we're not dealing with the specter of World War. But, you know, there are a whole bunch of really big problems that are starting to pile up and stack up that are proving actually quite difficult to resolve within our international system. Health is a big one. COVID-19 is an obvious example. But there are also huge income inequalities that are just not going away. Big companies using tax havens, corporations not paying their public dues. Or think about even the climate emergency, right? Another obvious example. So there's a lot going on with structure. I think every now and then throughout history, you get into moments where these problems pile up and something has to change. And so maybe you can be the generation that is going to also start thinking more about structure to make lasting change to some of these issues. Thank you.
Thank you very much to Stefan for those very interesting remarks. So now, before we move into a bit of a discussion, I'm going to invite Chris from the Health Think Tank to present just some of the conclusions from the governance pillar that we have come up with. So Chris has a bachelor's in European Public Health and is currently studying for his master's in Health Policy, Innovation and Management at the University of Maastricht. And he also worked very closely with me in developing the governance pillar of this paper. So Chris, if you're ready, I'd like you to invite you to present the conclusions.
Yeah. Isa, are you gonna like share the screen or? Okay.
Correct.
All right. Thank you very much, Peter, for that introduction. It's great to be here. So to start, very bluntly, like all the youth in the think tank and like throughout the EYP, we were all interested in the global healthcare challenges, and that we as the youth, we also want to see some changes in the health systems and for it to better evolve in the future to respond to these new challenges. Let me see. Okay, cool. So for the topic of health governance, the members of the think tank that worked on this topic, as Peter already mentioned, was himself, Maya, and myself. And then with the input and feedback from the other members, as you can see in the pictures, we were able to take out the main themes and address them in the health governance pillar. So these are the general principles in our paper. So to pursue universal health coverage, health in all policies approach was already mentioned, health as a global public good, and resilient and accountable systems. So the paper sees healthcare as an intersectoral area that permeates all policy fields and cannot be understood independently of another policy factor. So the health governance, so I wanted to quickly try to give a definition. Like this, I just found this in the WHO description. So these are the keywords that they were using. So basically governance, health governance, you can define it as like, broadly speaking, policymakers and decision makers that they try to seek national health policy objectives. So primary care or better quality of care, safety for patients, and that all these objectives that they try to put out, these will eventually lead to universal health coverage for all citizens. And as young Europeans, we want these issues to be addressed, and that we want these health challenges to also be tackled, not just for COVID, but also in the future for other problems. And then also this paper, so this pillar of governance, the data was all collected by the health polls and the EYP digital health events. So that's how we came to the main themes for this health governance pillar. Yeah. So these are the main themes that we concluded for our pillar. So we managed to subdivide it in 3 pillars. So first, the pillar of strengthening international cooperation and the WHO. Then we have fostering public trust through transparency and communication. And lastly, prioritize resiliency in health systems. These are the 3 main sub-pillars. Yeah, so for our first sub-pillar, we focused on strengthening international cooperation. With this one, we meant like the EU should have a common definition or common vision, for what global health is or what it should be. There's currently a lack of international cooperation, and this interferes with providing actual good health. So because of this, public global health isn't being given properly to others. Next, if we focus on financial contribution to the WHO, we need the WHO to become a global leader in promoting research and also like health recommendations, and also to just give proper recommendation and not just enforce them, but also more research should be contributed to this. This will be further discussed later on. And then lastly, promoting compliance to health regulations. So member states should try to achieve more universal health coverage within their policies. But that's within the EU. Yeah, thank you. And then the next sub-pillar will be fostering public trust. In this pillar, we focus on there should be an improved communication and transparency of EU level health policy making. So with this one, we were mainly focused on EU health institutions. So they should communicate more properly, like health information to the public and to other like stakeholders. Since health information is not widely available for all the public, it becomes very not so good when interpreting actual science. Within this one, we focus also on combat of disinformation. So again, you hear it all the time in the news, fake news, all of that, conspiracy theories. So in order to combat these fake news on social media, like there should be more open communication between scientists and between an average citizen. It should be also promoted in their own preferred language. So then there's even easier access to communication for everyone, not just citizens, but also a scientist between a citizen as well. And then lastly, increase reporting of monetary activities of health. This is also important for EU institutions to also release this and to also so we can see where the funds are going and not to just assume everything's going right. And yeah. And then lastly, this is the last sub-pillar. So prioritizing resilience in health systems. So within this pillar, we focus more on the resilience. So health systems should be a resilient priority in the EU agenda. With this one, we meant that like member states should try to invest more on making their health systems more effective, more efficient, and also able to combat other challenges that isn't only focused on COVID, but also all these other challenges, as you can see in the picture on the right. Like these are the challenges that they should try to reinstate and try to focus on. And then the EU Commission should at least try to assist the member states. They shouldn't get involved because member states get very, they don't like when the European Commission gets too involved in these in health. So member of the European Commission should try to at least recommend a few things and what areas of health they should try to improve. With this, you get all these goals, as you can see, and with the WHO, there could be a better cooperation in the future to make the health systems more resilient in all member states and also around the world. Yeah, and then this is the final slide. So how can global health institutions be strengthen more resilient and accountable systems? This I'll leave to Peter to add to the panel. But then also a few other questions I thought of while making this presentation was, why is it that we trust or want to cooperate with the WHO? And lastly, another question I had was, are health resources channeled in an effective and efficient way in the healthcare system? And that's it. Thank you.
Perfect. Thank you so much to Chris for those questions. I think there's quite a lot for us to pick up on. Maybe it would be a good idea to start with this governance aspect and the idea of promoting further. Well, obviously the whole thing's about governance, but this idea of cooperating more and promoting a stronger WHO and international cooperation. And I suppose my question to the panel would be, what's the best way to encourage national level actors to partake in more cooperation and to strengthen the WHO? In our paper, we talk about need for social justice and promoting universal health coverage, and this being motivation enough to get people to come to the table and to promote global health. But I'm wondering, do you think that it's if there's a role for also using other motivations, such as pointing out the importance of health to security or health to climate change, how we can actually convince those institutions to kind of come to the table and promote WHO. So maybe with Stefan, if you wanted to start with that question.
Yeah. Well, it's a great question, and it's one that people have been wrestling with, for a really, really long time. And the poor WHO often suffers from a kind of, it's called the World Health Organization, right? And it's supposed to work for the highest attainment of health for all. So it has these kind of huge expectations placed on it in the field of health, and especially during pandemics. But when you kind of scratch below the surface, right, it's really not a health delivery organization in the way of which we think of a health care system. It's really more of a diplomatic organization. And when you scratch further still and you look at like the budget of the WHO, it's really quite small for an organization that's supposed to have a kind of global remit and a global reach. So countries are not giving the WHO a whole lot of money to work with in the grand scheme of things. And then if you dig further still and you look at that budget, you realize that actually only a small percentage of that WHO budget is actually budget that the WHO can decide on how it's spent. The vast majority of the WHO budget comes through something called voluntary contributions, which is where governments and foundations give additional money to WHO, but it's tied to particular projects or strands. So it's not, the WHO doesn't have autonomy about it. So the WHO is actually always in a really difficult position, managing quite few resources. And of course, it's also organizationally a really complex institution, because when you watch the media coverage of WHO, they often show you the Secretariat in Geneva, but actually the WHO consists of several regional organizations, which are again quite autonomous and quite powerful. So it's a complex organizational structure with limited resources, and that's why I think it's right that you call for more money. It's going to be particularly important now that the United States has announced its withdrawal from the WHO next year, unless, of course, there's a change of that decision after the election next week, which may happen. But others will have to come in to fill the funding gap. Other than that, you have to, as I said earlier, find arguments that motivate governments. And I think, one of the things has been the security argument. The security argument and pandemics has been very effective, actually, at putting health on the agenda. But it's also each strategy has benefits and drawbacks. And of course, it also means then that you end up prioritizing particular types of health issues, which may not be the priorities of everybody else around the world. And there are many non-communicable diseases that are also important, but that don't really fit this kind of outbreak security framing as well. So there are different strategies and drawbacks, but certainly the framing is one key thing. The other thing is you have to use skillfully whatever you can muster and mobilize. And at the moment, of course, everybody is talking about health. So this is actually a real opportunity, and why the timing of the report is also so good, because right now everybody's talking about health. Often in the health field, we go through this kind of cycle of boom and bust. We're in an outbreak, everybody's talking about it, Ebola, Zika, pandemic flu, whatever. But then as soon as it passes, the whole media wagon moves on, and it becomes much more difficult to keep attention focused. But now is a real opportunity to actually, everybody is thinking and talking about health. And I think some countries are going to put more money into WHO.
Perfect. Just before I let Beth come in on that one, I wanted to maybe also pose the question, how healthy do you think then, as Stefan was saying, is it that, you know, non-state actors such as the Bill and Melinda Gates Foundation, for instance, play such a strong role on the international governance kind of stage?
That speaks to one of the first points that I wanted to make. So I'm a policy and advocacy professional by training. That means really I'm a lobbyist. We're there to influence government's decisions. And I think Stefan there actually talked like an advocacy person. So there is a kind of tactical moment here to seize. And I think in a way you can't be, it's better not to be too precious about the arguments that you use. You just have to find the arguments that work, and they might not be the arguments that resonate with you as an individual, but you have to really think about that target audience. So I would second everything that Stefan has said about that. But the point that I wanted to add in terms of how, coming back to Chris's point actually about how do we get people to trust the WHO, and part of this question of how we get to pay more money in is, I think, about creating trustworthiness and creating transparency and a rigor in that. And I think we see actually the EU institutions work really hard to be kind of ultra transparent, and sometimes that creates so much information it's hard to see what's happening. But I think being as transparent as we can is really important to build trust. So to Peter's question about, you know, is it appropriate that we have these non-state actors like Gates, and indeed to a smaller level organizations like Wellcome contributing in this way? I think, to be honest, at the moment, we don't have a choice. We need that coalition of the willing that Stefan mentioned earlier to make sure that we're all pulling together in the same direction. And different actors within a system will always have their own interests. And I would argue that that is not a problem as long as we match it with that transparency. So we're clear about how people are participating and on what basis they're participating. And the reason I think that's so important at the moment is if we look at the geopolitical context that we're in, and as Stefan said, the withdrawal of US funding, we desperately need more actors than fewer. And I think there is therefore a really interesting role for the EU at this point to galvanize that international community and play a leadership role. And I think we've seen the EU trying to step up. Von der Leyen has been active on this issue. She's been vocal and present. And the WHO will need that, as well as looking internally. I think it needs to look for those champions who can fight its cause. And lots of this, ultimately, to go back to Stefan's original challenge about structures, is this question of power that we've not talked about yet. And I think that will keep coming up through this discussion. But so not only does the WHO not have a lot of money and not have much control over its budget, it doesn't have power. It's working to kind of channel and convene views, and it can give guidelines and it can say things, but ultimately the WHO doesn't have the power to make its member countries act. And we see the same thing, I think we'll come to this in a later section, in terms of the EU, and Chris talked about this. Health is not an EU competence, it's a member state competence. And I think there's a really interesting philosophical question for you as the next generation is, do we want to cede more national sovereignty to make global systems work better? As a Brit, and with Brexit going on, I probably can't have too much to say about this, but I think it's a huge kind of value question that's facing us globally.
Perfect. So before I go back to Stefan, if anyone in the audience wants to ask a question about this first pillar on international cooperation, strengthening the role of the WHO, if you just want to raise your hand in the participants tab of the Zoom, and we can come to you in a second. But I want to maybe bat that back over to Stefan. Do you think that European Health Union, or as we suggest in our paper, strengthening the Council conclusions on global health is perhaps the answer to this kind of lack of power for international institutions and maybe ceding more sovereignty towards higher institutions?
So I do. So, I think, the challenge of structure that I talked about at the beginning is a huge challenge, So actually regions can be a good kind of intermediate step for starting some of this work. And what Beth said was absolutely right, but even within the EU, health is a kind of, it's a national competency. And it's not even just a national competency within European countries. It's like a subnational, like in Germany or in the UK, they're the nations. Like it's not even at, health is, we like to think about health as this nice, warm, fuzzy, cuddly thing, but it affects everything we do, how long we live, how we have relationships, so it's actually quite a political thing, and people are hesitant to kind of give control over it away. So I think, but tying it back to the earlier question, right, what the EU was able to do even before COVID, right, was to say, well, look, health is a national competency, but there is a separate, or there's a special category of health issues, which are cross-border health threats, which affect all of us within the Union. And here, there can be an EU competency. And it's, of course, for that reason, on the back of SARS and pandemic flu, that we saw the creation of ECDC at European level, and where we saw also the European Commission having, creating a new committee, it's called a health security committee, to deal with these kind of cross-border health threats. So it's a good example of how, like, a security argument ended up carving out a bit of a competency at European level, and laying some important groundwork that the EU may be able to build on now. In terms of the Gates Foundation, this is a really great question, and a lot of people are afraid to talk about the Gates Foundation publicly because they are very influential and they do have a lot of money, but it is, if the US pulls out, which may or may not happen, we could be in a position where the Gates Foundation is the largest single donor of the World Health Organization, and that's just, you just go, wow, that requires some thinking about. And in one sense, it's huge luck, that Bill Gates decided that his fortune was going to be spent in global health, and there's a lot of global health benefits that have come from that. But politically, right, there is the issue that with that much money and with that much influence, who is Bill Gates ultimately accountable, and who is the foundation accountable to, right? And this is where it gets a little bit uncomfortable, because some people might prefer the actors who have the most influence to be ones that are democratically accountable through the ballot box and so forth. And this isn't necessarily the case with the Gates Foundation. But as Beth said, unless we can have structural change, there's so much unmet health need in the world that it's really a case of trying to bring everybody and anything that you can together around this role. But if we had a different structure, we might not have to rely on private foundations in the same way. So if you think about all the things that this report is asking for, at least in high-income countries, all of these things are already actually achieved, right? Within a country which has a certain amount of national wealth and which has a central government, you are able to make laws that say everybody has a legally guaranteed minimum amount of access to healthcare. You can tax your population, and you can say, you know what, no matter whether you're rich or poor, we are going to take this public funding and we're going to create a national health system so that everybody has access to a minimum amount of healthcare, whether they are rich or poor, or whether they live here or there, right? And of course, because you have the power of the state, if people don't abide by the rules, there's also some capacity to enforce these rules and laws. So with the right structure, all the things that we want to see, it is technically feasible and possible. we just don't have that kind of structure at the international level at the moment, right? And it may seem fanciful to talk at such a big level, but every now and then, there are big bangs throughout history and the problems pile up and there is change. So I'll leave it there.
Perfect. I want to then bring Chris in and hear your response to that, Chris, about how really we need structural change if we're going to make a difference.
Yeah, well, that is really hard to really answer, because even if there becomes a structural change, you notice immediately that there are some issues that we still need to address first in order to make those change happen. It's a really complex, and again, Stefan, you already mentioned it, it's all about who has the power and who has the actual funds to make this happen. So to me, I really don't have a concrete answer. I wish I have the solution for that. I wish my bachelor degree and my master's degree can tell me a solution, but so far it's just theories and nothing has been really worked out in practice yet. So I hope in the future that we as the youth, we can actually take this opportunity and actually move forward to a better health in all policies and also universal health coverage for all. And also, I really want to address I was looking at the chat box. There was a question for me about if I see real chance of strengthening the ECDC. Personally, I do, with the educational background that I have. ECDC was established in 2003 or 2004 because of the SARS pandemic back then. So it was all about lobbying as well. It was Beth already said it, actually. It was right on the timing, because the EU was discussing to make something agency to control and to monitor disease in Europe. And it was all about the timing, and they really made this happen in the EU. They put it on the agenda immediately as soon as that happened. So here in this current environment, the ECDC should be strengthened more and also more funded, and also they should make it more accessible for the ECDC to deliver their information to the public easier. Because for me, I understand the scientific evidence, but I think to an average parent, I don't think they fully comprehend it, because they see a Facebook post or they see a Twitter post. So it's very complex. So I think the ECDC should also get involved more with the patient directly. So yeah.
Perfect. Yeah, so I think that's a great segue into then the second pillar, which is about transparency and communicating science. And before we do that, just to encourage anyone from the audience who wants to ask a question, feel free to raise your hand and we can come to you. But maybe if we start with Beth on this pillar then, I'd be interested to hear your thoughts on disinformation in health, and also how we can communicate scientific research, as I think there might be some lessons that we could have learned, certainly in the coronavirus research field, where we had numerous preprints and all sorts of things happening and being perhaps misconstrued by the media and then passed on to the general consumer.
I think there's two aspects of this that I'd like to talk about. So one is that scientific body of evidence and how we make sure that even at pace, it's done with rigor and integrity, and we make sure that we get great research. And I'm a big fan of preprints where people publish their research early, because I think it's better to have the research out there. But we do have to make sure that it's not done so fast that we don't end up with good research. And when we get to the other end of the publication process, open access, as I said earlier, is really important to us. COVID makes the case more strongly than ever. And it's really important that we uphold that, and the institutions, so funders like Wellcome, but also the EC through its Horizon program, that we push and provide the incentives for people to publish their research in a transparent way. But then there is how that research gets to the public. Chris and Peter have just talked about this, but I think there is an imperative to make sure that we communicate science as well as possible. There's lots of good practice in how to do this, and there are some fantastic science communicators out there. And in lots of ways, it's not as hard or as complicated as people make it seem, but it takes time and it costs money. And I think it does need some investment. But also in the pandemic, often the governments have been the intermediary of that advice between the information they're hearing from scientists, the science that they're looking at, and then talking about their policy decisions. And I think there's been a big conflation between in the policy making process, or at least in how the policy making process has been described, in saying, yes, the scientific evidence is one input, but there's other inputs into that in terms of factors like the economy, and we have to weigh up societal, social issues and the science, and they won't always point in the same direction, though often they might do. But so I think we've got two challenges in the pandemic. Yes, we have to communicate the science clearly, but we also have to communicate policy decisions clearly, and they are not necessarily the same thing. And I think there, certainly in the UK, early on in the pandemic, we had this rhetoric that we will follow the science, we'll do what the science says. That is just not how policy making works. It's always a weighing up of different decisions. And now we can see, you know, later in the pandemic, where the government are, I think, finding the decisions harder, it suddenly looks like they're not following the science, because the science advisors are saying one thing and other things are pointing in a different direction. Government makes a different decision. And I think more transparency and communication about that process would actually really help us, because if you are not close to these processes and all you're receiving is different messages at different times, I think it's enormously confusing. And that in turn shapes how people behave, and therefore how our countries are responding and coping with the pandemic. So it's a really, really important issue.
Perfect. So yeah, I'd like to throw that over to Stefan, and I suppose I'd be interested to hear as well how communicating science well is important, as Beth says, for getting public trust and support for measures that promote universal health coverage and, you know, health equality as well, and how that therefore transfers into the kind of policy arena.
So for me, as a kind of political science and international relations person, you know, there are long-standing issues around science communication, but there's also something a little bit different going on at the moment, which is linked to the politics of responding, especially to outbreaks. So one of the things that I learned when reading around a little bit in the history of international health cooperation, you know, you can go back to the 19th century and the international sanitary conferences. And I thought, oh, surely all these people were meeting to discuss how they can minimize the spread of disease within Europe. And it turned out, well, that's, you know, there was some of that, but that was not really the main driver. What they were really fighting about was, what would you do in response to the disease? And it was about delimiting who could quarantine for how long and so forth, because this, of course, was having massive impacts on trade. So from a political point of view, you know, especially outbreaks, they always come in twins. There's the outbreak, and then there's the response to the outbreak. A problem with something like COVID is that the cure, you know, lockdown, is almost as bad as the disease itself. And so it's not just a question of, you know, science communication. It's that the scientists are telling us some very hard truths, and they have massive economic ramifications. And there's a lot of people who have strong economic interests to defend, you know, and who are actively downplaying or misrepresenting the data. So it's not just, I think, a question of science of communication. It is also, as Beth said, the wider politics around this, and that people are also actively trying to create disinformation, which you know, makes it an even bigger and kind of more protracted issue from my point of view. You know, you can't just lay this on the footsteps of the scientists and say somehow they're just not very good communicators and so forth. There, you know, there's some great science communicators, but there's also some very powerful interests that are creating disinformation or trying to sideline the science. And you know, for me, that just goes back to the fact of just how political health is at the end of the day.
Perfect. Yeah, I think that's certainly very interesting that, you know, the politics can influence how the science itself gets presented, and perhaps more optimistically in some cases than it necessarily is. I see we do have a question from the audience from Athena. If you're, yeah, feel free to go ahead.
I find your ideas and your proposal very interesting, and I agree with them. I wanted to add a point about the problem, like the propaganda and all this disinformation that is coming. I think one part of it is like, for example, like the people who believe in 5G or the anti-vacciners. These people, I think that this is important to like somehow to teach these people, or like to show them that what they're believing in is not true, and that, I don't know, because this is causing a lot of problems. There are people out there who are believing stuff that are wrong, and I think this is a main point that, I mean, it's like one problem that we need to overcome in order to reach our goal. Because if there are people who insist on something wrong, like for some people this is the truth, but if you show them scientific like documents and stuff like that, I think, like, I mean, you understand what I mean, like it's a problem that needs to be solved, and I think it should be mentioned because it is a problem and it's a fact. So I don't know how it can be solved. Like Einstein, like stupidity sometimes cannot be like, I know it's a lot weird, but yeah, that's my point. Thank you.
Perfect. Maybe, I don't know if Beth, you wanted to come in on any suggestions about how we can tackle like this disinformation and you know, these conspiracy theories and 5G. Like, is there more that we need to do other than just being transparent? And maybe if you have any thoughts on like communicating science better. So maybe if we can take from Beth, if that was possible.
Yeah, so I think it's really important we start by understanding what is driving people's behavior and their fears and what they think about these things. Because I think if we just say people are stupid, they're badly educated, they don't read the news enough, then we're missing a really fundamental point about where people, like how people live and how people are. And I think we can't expect as a science and as a global health community for people to come to us all the time. We have to reach to them where they are in their lives. And I think that starts with understanding what they're feeling, what they're experiencing. And I think that will help us do the job better of tailoring the communication and putting it in the right place. Because I think it's easy to make lots of assumptions about how people get their information that we don't always fully understand. So this is where I think actually anthropology and the social sciences are really important forms of study to tackle this crisis. Science, I don't think, can tell us the answer, but the social sciences can. So I think we need to apply some of our own kind of scientific methodological rigor to really understanding the problem, and that will help us get to a better solution. But my hunch is that we need to take the right information to where people are, not expect them to come to us.
Perfect. Yeah, I think that's really interesting. Yeah, that we need to involve a broader range of expertise in order to ensure that we're communicating that correctly. So we are kind of running out of time. So if we could maybe just move on and squeeze in the third pillar. So this is about health system strengthening and promoting resilience of healthcare systems. And I suppose my question for Stefan would be, how much should we expect global or European institutions to support national level health systems? You know, why should they do so? And yeah, if you have any kind of thoughts on health system strengthening.
So I think health system strengthening is one of the most important things that needs to happen. People are working on it. You guys are rightly calling for it. But the question again, as you know, as was implied in your question, is you also need funding and redistribution of funds to make that happen. And ultimately, of course, you want countries to be able to stand on their own 2 feet in the long run. And also, it's, you know, it's not great for countries also to be in a kind of continual relationship of dependency on high-income countries for their health. You know, I don't think that's a great position to be in the long run either. So what's really interesting, you know, what WHO is doing at the moment, it's actually trying to take health system strengthening and linking it in with global health security, right? And to say, because COVID again is the obvious example, right? You are only as secure as the weakest health system that's kind of out there. And so it's trying to marry the kind of wider aspirations for global health also to some of the self-interest of some of the high-income countries in terms of better managing outbreaks and so forth. And so again, it's a kind of similar story, actually, isn't it, to the EU, where you start having a kind of security argument about pandemics kind of breaking through. And, you know, I mean, back in my days, it was HIV/AIDS, which was like the first health issue ever discussed by the Security Council, you know, and at the time, everybody was like, what do you mean? Well, the health issues aren't security issues. Now it's much more commonplace to see these linkages. But we're kind of similarly seeing a similar process now at kind of WHO level, where they're trying to bring kind of self-interest and more humanitarian things together ultimately. And actually, you know, if you're going to do that, now's the time to be making that kind of argument, because we are in the middle of a pandemic and it's obvious to everybody. So I think I'll leave it there, because we're running a little bit short on time.
Yeah, no worries. So yeah, like, be interested to hear your thoughts on that, Beth, about, you know, health knows no borders. We should link this with self-interest and tell countries that you know, it's in their own interest to promote the health of other countries, or do you see some pitfalls in that kind of securitization of health approach?
I think in terms of where we are now, it's a strong argument to make. And one thing, I don't think I can add much to what Stefan has said, but I think it's one point that I would say is, we often, when we're talking about health systems, are talking about a reactive health system that can care for people when they're sick. And I think it's really helpful to be explicit that actually in health system, we need a strong public health system that is dealing with prevention and managing public health issues, as well as dealing with people once they get ill. And I think particularly when we're building health systems from a low base, if you can build that in from the outset, that would be incredibly powerful. So I think there's something about learning lessons from other countries' health systems, as well as the resourcing that we should really take on board. And that learning lessons does not necessarily go in always the global north teaching the global south, or high income teaching low income, because we have lots of high income countries that have terrible or non-existent public health systems. So I think that's something that I would like to throw into the debate, and I think is clearer than ever with COVID that it's the countries that have really strong public health systems that are in the best place to respond.
Yeah, and I suppose then that's actually applying that kind of security argument on an internal level and saying you don't just need all the ICU beds and all the wonderful cancer treatments, but that if you have good preventative, that can pay off. And I suppose looking around the world, as you say, the countries that have had that, you can see that they've had a very different kind of outcome in the pandemic. So I suppose I'll give the final word to Chris, if you have any response to those points about the resilient healthcare systems, or any final words from the point of view of health think tank participant.
Yeah, no, like I fully agree with that, like all the statements that were made, like not regarding this last sub-pillar, but like the previous one that Beth suggested about the disinformation part. I also feel like there should be a fact check as well in the scientific community, because there's also personally I've seen some people, they just grab a scientific article and they start quoting that because of the conclusion that they made, but also like there's no one fact checking this, no one's checking out the articles to see if the methods are correct, if the study population is like big enough. So even in the scientific community, there should be more fact-checking. But again, it was also already mentioned that there's not a lot of funding, or there's not a lot of money going to people checking these things out. That's all I wanted to add, but yeah, thank you.
Perfect. So thank you very much to Stefan and Beth for joining us, along with Chris from the think tank panel. I thought that was a really interesting discussion that we had about the governance aspect of the think tank, and how I think we've really touched on how important these structural changes, as Stefan says, are going to be going forward in the era of COVID, and that this really kind of represents a seminal moment for young people to put forward solutions to that, and to come up with innovative ways that we can improve the global health structures and create better health outcomes for all. So thank you very much to everyone who's either listening on Facebook Live or on the participants list, and thank you if you've also been listening in on any of the other panels that have been taking place this week. But that concludes today's event. So thank you very much, everyone.
Thank you.